always remember, new clinicians, you may have these great grandiose ideas for therapy for your patients, but it's really not about you. It's about the patient. So make sure you include them in your therapy planning and make sure you target those things, those functional things that they want to target as well. So, hey y'all, it's me, Lauren from Speak from the Heart, where I give you all things speech, language, and life. I am a licensed speech language pathologist, and I'm so happy that you are viewing my newest video. And I'm going to be sharing some very quick general tips to target functional improvements and gains in therapy. So I have had so many students reach out to me and they're like, I'm submitting my therapy plans. My supervisor just keeps cutting me down. I don't know how to target these functional things in therapy. So here's a video, very general. I'm gonna give you just really quick examples for 3 of the most common diagnoses that I see in my workplace and how I try and implement some type of functional task into the patient's therapy plan. Before we deep dive into the video, make sure you like this video because I think you're gonna like it. So you can go ahead and like it before you even see. And subscribe to my channel. We are growing over here. And yeah, let's hop right in. So let's talk about aphasia. So aphasia is very prominent in the medical setting, especially in outpatient rehab where we have more time to spend with the patient. So we're targeting some more in-depth goals. So when we think about aphasia, and I'm just going to give you an example of someone who has expressive non-fluent aphasia. So some ways that you could target some functional tasks is, for one, the first thing you want to do is at evaluation is kind of gauging what the patient's interests are, what they like to engage in, what their day-to-day is like, so that way you can incorporate some of these functional tasks. But once you have that, one thing to think about, especially if the patient is non-fluent, is MIT, melodic intonation therapy. I use this a lot with my patients who have non-fluent aphasia, and one way that you can use this is incorporating functional phrases. So once you've passed like the intoning phase of doing all that, you can incorporate functional phrases. So maybe the patient has a lot of doctor's appointments and they struggle with saying their name, their date of birth, the last 4 of their social security number. So you can practice, intoning these things and tapping the left hand so that it is a little bit easier for the patient to say them. So maybe the patient's name is Jim Jones. So you practice, Mr. Jones, let's practice your name. Jim Jones, May 12, 1948. So kind of going through those functional, that functional information that Mr. Jones would probably have to give every time he goes to his doctor's appointments. So that way you're making a lasting functional impression on what the patient is doing in their day-to-day life. All right, so let's talk about motor speech disorders. So specifically dysarthria. The way that I would go about doing treatment with someone who had acquired apraxia would obviously be different than dysarthria. So for the purpose of this video, we're just gonna focus on dysarthria as a motor speech disorder. Is to come up with a list of 10 to 15 functional phrases. I'm not lying to you, I do this for everyone who has dysarthria. So, you and the patient can come together and make these up, or the patient can just do these, the patient and family, whatever, or however you want to do this. But what you are doing when you're telling the patient, hey, I want you to think about 10 to 15 things that you say or ask or that are important to you, things that you say and ask often. But what you do with that list, and this list can literally stay with you from your first session all the way to the patient's discharge, so you can really track progress. But after you've had that conversation with the patient in regards to compensatory strategies that they might use in order to maintain a level of clarity with the speech, so maybe over exaggerating oral movements for those stronger oral movements and those more precise oral movements for speech and speech clarity, you can have the patient apply those strategies to these functional phrases. One way that you can add a level of intensity to it, and this is based on the Be Clear protocol. It is an evidence-based protocol for dysarthria. It is like a 4-time-a-week protocol, so some people they don't want to come 4 times a week. So I have taken that area of Be Clear and applied it to my own practice, but having them repeat them 5 times. So going through that list of 10 to 15 functional items and having them repeat them 5 times. So as you go through those 5 times, those 5 repeated trials, there may be some sense of fatigue that sets in just because of the nature of dysarthria. So that's a great way to challenge your patients to continue to use these strategies and to also maintain that level of clarity from the first trial to the 5th trial while targeting these functional and meaningful phrases. And that again is pretty structured, so obviously you would want to target conversational speech as well, but just to give you an idea of maybe how you could start in therapy. I actually wanted to give some advice for dementia. So I'm gonna be completely honest, when I started in the medical setting and had my first referral for someone who had dementia, I was like, what do I do? Like, how do I help this person? But throughout, my research and just continuing education, I have found that spaced retrieval training is such a great treatment technique for people who have dementia. One way that you can use this in a functional way, and I'm actually going to give you an example that I've used just a couple weeks ago. I had a patient, or let's say you have a patient, let's put it back on you. You have a patient that comes in who has dementia, and maybe Alzheimer's dementia, and the wife is reporting that the patient's having a really hard time remembering to grab their mask when they go out, or like go out of the car and go into a store or restaurant because of the pandemic. That's exactly what I had happen, or I had a patient who had dementia that just could not remember to grab his mask. He would just get out the car, go in the store, and didn't have a mask on, and obviously that's a detriment to his safety and health. So we use spaced retrieval training in increments of, let's see, it was 15 seconds, 30 seconds, a minute, 2 minutes, 4 minutes, 8 minutes. And within 2 sessions, y'all, he was able to remember to place his mask on when I gave him that cue. Mr. SLP patient, Mr. SLP patient, what do you do when you're about to go in the store? Or what do you grab when you're about to go in the store to keep yourself safe? And after 8 minutes, over 2 sessions, he was able to put his mask on independently. And I was like, my work here is done. No, but seriously, it was so great, and his wife was so excited because she truly just didn't think that he would be able to, because we think dementia, it's a memory impairment, it's a cognitive impairment, it's progressive, it's degenerative, and this man was able to remember and recall the steps needed to keep himself safe. And so that's a great way to target functional tasks, day-to-day tasks, and people who have dementia. Okay, so obviously that's not the full extent of like my patient caseload. We see so many different types of patients with all types of neurogenic communication and swallowing disorders and voice disorders and all types of things. So this is not an exhaustive list, but I just wanted to give some specific examples of ways that you could target functional, or have functional targets in your therapy sessions with just a few medical SLP diagnoses you may see. I always like to sit with the patient and say, what do you want to work on? How can we make therapy functional for you? What is important to you? And then I'm gonna do my job so that we can make these things easier. So thank you so much for watching. Make sure you subscribe to my channel, and I'll see you in the next one. Bye.